The surveys for PNG shows that poorer households are more likely to have implemented coping strategies that reduce their savings and increase their household debt. Survey finds that while levels of employment, access to education and healthcare remain relatively stable from January to June 2021, 93% of households in PNG had used at least one economic coping strategy since the beginning of 2021, and 40% had used 5 or more coping strategies. According to the third round of surveys of approximately 3,000 Papua New Guineans, 88% are very worried or somewhat worried about their household finances. The most common coping strategies including finding ways to earn extra money, spend from personal savings, and receiving non-cash assistance from friends or family. Only 7% of households reported receiving any assistance from national or provincial governments. Nearly half of all respondents felt that conditions related to drug and alcohol abuse had become worse since January 2021, which is the same result as in the first survey. Stefano Mochi, World Bank country manager for PNG, said that with the reality that the pandemic will continue to cause significant impacts for some time yet, it was vital that formal safety nets and assistance are expanded in Papua New Guinea. Mochi said families who are in the bottom 40% of incomes are reducing their savings and assets and increasing their debt to keep everyone fed and going to school. Claudius Kamenga, UNICEF representative for PNG, stressed that the ongoing response efforts are critical for children and adolescents. He said while COVID-19 continues to affect families and communities differently, it is clear that the most vulnerable households are especially hard hit. Kamenga said more than 3/4 of students who were not able to benefit from distance learning during previous school closures, those in vulnerable households, will find it even harder to participate in future distance learning opportunities. Frida Kana, TV1 News.